CCW Practice Test 2026 Certified Care Worker Exam Questions and Certification Test Prep. Question 1. What is the primary role of a certified care worker? To perform surgery, to provide daily living support and personal care to clients, to prescribe medication, to manage a hospital. CCWs assist with ADLS, activities of daily living, such as bathing, eating, and dressing. Question 2. Which of the following is a sign of dehydration in an elderly patient? Increased energy, dark-colored urine, excessive sweating, clear skin. Dark urine and dry mouth are common indicators of dehydration. Question 3. What does HIPAA protect? Clients' physical safety, clients' health insurance rates, clients' private health information, the facility's furniture. HIPAA ensures the privacy and security of health data. Question 4. How often should a bedridden client be repositioned to prevent pressure ulcers? Every 8 hours, every 4 hours, every 2 hours, once a day. Frequent turning, every 2 hours, is standard for preventing skin breakdown. Question 5. What is the golden rule of documenting care? If it isn't written down, it didn't happen. Write as little as possible. Use pencil only. Document only at the end of the week. Accurate and timely documentation is legally and clinically essential. Question 6. Which of these is a technique for effective communication with a client who has hearing loss? Shout loudly. Face the client directly and speak clearly. Turn away while talking. Talk very fast. Visual cues and clear, moderate speech help significantly. Question 7. What is asepsis? A type of infection. The absence of disease-producing microorganisms. A cleaning chemical. A bandage. Asepsis refers to the state of being free from pathogens. Question 8. A client is falling. What is the safest action for the care worker? Try to catch them and hold them up. Guide the client to the floor while protecting their head. Run and get help immediately. Tell the client to stop falling. Attempting to catch a falling person can injure both the worker and the client. Guiding the fall is safer. Question 9. What is respite care? Emergency surgery, temporary relief for primary caregivers, a type of end-of-life care, physical therapy. Respite care allows family caregivers to take a break while the client is cared for by professionals. Question 10. Which of the following is considered a normal adult resting heart rate? 20 to 40 BPM, 60 to 100 BPM, 120 to 150 BPM, 200 BPM. 60 to 100 beats per minute is the typical range for adults. Question 11. When assisting a client with a weak side to walk, the care worker should stand on the client's strong side, on the client's weak side, behind the client, in front of the client. Standing on the weak side provides better support and stability. Question 12. What is dementia? A normal part of aging, a specific disease, a group of symptoms characterized by memory loss and cognitive decline, a temporary loss of vision. Dementia is a term for a decline in mental ability severe enough to interfere with daily life. Question 13. True or false? Hand washing is the most effective way to prevent the spread of infection. True. False. Proper hand hygiene is the #1 defense against germ transmission. Question 14. What is the correct procedure if a care worker notices a new bruise on a client? Ignore it if it looks small. Report it to the supervisor immediately. Ask the client to hide it. Apply ice without asking anyone. Any changes in skin condition or signs of potential abuse must be reported. Question 15. What does PRN mean on a medication order? Take every morning, as needed, immediately, by mouth. PRN stands for pro re nata, or as circumstances require. Question 16. Which nutrient is most important for tissue repair and muscle maintenance? Sugar, fat, protein, caffeine. Protein is the building block of body tissues. Question 17. A living will is a document that lists the client's assets, outlines the client's preferences for end-of-life medical treatment, dictates who gets the house, is only for young people. Living wills provide guidance when a client can no longer speak for themselves. Question 18. What should a care worker do if a client refuses to take a bath? Force them into the tub, respect their right to refuse and try again later, threaten to take away their lunch, call their family and complain. Clients have a right to refuse care. The worker should look for the reason and offer alternatives. Question 19. In the PASS acronym for fire extinguisher use, what does the first S stand for? Stop, sweep, squeeze, scream. Pass, pull, aim, squeeze, sweep. Question 20. What is holistic care? Caring only for the body, caring for the whole person, physical, emotional, social, and spiritual, caring for people in wholes, caring only for the mind. Holistic care addresses all dimensions of human health.